Um, well, thanks so much for joining me. I'll just kind of tell you a little bit about myself, just so you have context for who you're speaking with. I'm a emergency medicine physician here in Houston, Texas. Actually graduated from UT Austin back in 2013. Went off to med school out of state, residency in UT Health San Antonio, and then am here in Houston now. I, a year and a half or so ago, got this Web3 kind of interest through the proxy of NFTs, kind of seeing celebrities launching NFT projects and whatnot. And everyone was kind of making fun of it. I was kind of in that group of people and kind of looked into, what is this NFT thing? And then kind of going down that wormhole, realized that it's more about the technology underlying what NFTs are and what these other kind of things are. And then saw that this technology is something that can change entire sectors and industries, and realized that that applied to healthcare as well. And so that's kind of what got me more interested in learning about what this technology is and how it can change things. I found myself at a conference in Austin a couple months ago, and I think there was a faculty member from the department that you were with that was speaking about some of the stuff that UT and Dell Medical School was doing around blockchain technologies and social determinants of health, and things that were really interesting to me personally. And so that's how I came to reach out, and was super excited for y'all to respond, and for y'all to chat with me. And if I understand correctly, you're the director of research and innovation at Dell Medical School's population health kind of group. And I'm excited to chat with you. And so just kind of, first question, what is it that you do on a day-to-day basis? And I guess we can use that as a jumping off point. Sure.
Yeah, thanks for that quick intro. Good to hear about your interest there on NFTs and all that, and I can understand quite well why so many people, not understanding what it really is behind the scenes, would be skeptical of the point of using those new innovative solutions. So yes, I am the director of research and innovation, and I lead the health informatics team here at Delmed, and we, as my title says, we lead several research projects that are usually along the lines of health informatics and innovative solutions that can help transform healthcare. So what that means is that we have been working on different technologies that can range from natural language processing, or blockchain in healthcare, or in specifically like some solutions that we build for patient access to health data, as one of the federal requirements currently. And yes, social determinants of health is a major line of research and work that we do as well, with tools that we have built and that we have transitioned some and are transitioning others to the community to utilize in real settings. So that's high level. The line of work that we have is anything that has to do with health data, and that stretches the utility of data and the assets that we have to better inform healthcare, to improve outcomes, to improve patient engagement in their health, all of the above. Does that give you a good sense of what we do?
Absolutely, yeah. And it's stuff that, I, as someone who works in the ER, I see a lot of the flaws in the healthcare system. And so whenever I have conversations about these topics, it excites me because, these are the solutions that will eventually get rid of a lot of the issues and the issues that patients truly have, that we see on a day-to-day basis. So I guess kind of moving on to then the blockchain aspect of it, in terms of what you all do, where does blockchain come in terms of as a potential solution to some of these kind of broad topics that you mentioned? And I guess a second question, or more kind of broader question, is it, how big of a tool is it currently? Is it something that, maybe is like 1% of your resources are dedicated to seeing like, how can this help us? Or is it larger than that and whatnot?
Yeah, so there has been quite a few years of work in the blockchain side of things, and has been heavily informed by our medical students and by, UT students as, subjects as opposed to real patients in clinical settings yet, and throughout the years, I think we have basically focused on two key goals. One is patients getting access to their medical data and maybe having that data available at their fingerprints through blockchain, accessible through blockchain, but not necessarily with the data in the chain because that's complicated to do, but at least that in the blockchain, you have the access controls to be able to then access your own clinical data that's stored somewhere. There are some strategies there. I think at some point, it'll be feasible also to store the data in the chain itself, but as of now, I think we keep that separated. But using blockchain to be the place where your consent for someone to access your data is being managed, as opposed to a central organization that provides that access. So we've developed an application that we call MedLinker. We have a few papers published on it that basically allows through blockchain you to one, get validated in terms of your identity by organizations in a network that basically would confirm that you are who you say you are and store your documents in your app, like your driver's license, your form, your insurance card and your form of payment, and then allow you to register with organizations that would have the same platform so that you can check in within each organization that you visit and then authorize them to access some piece of your data that you retain, and then withdraw that access whenever you wish. I think the primary use case that we're working now that becomes important for that utility is actually with the Houston Department of Health for PrEP, patients that are utilizing PrEP for HIV, where the sensitivity of their data is paramount, that at times they would like someone to know so that they can be authorized for the services and medication. But at the same time, at any point in time, they wish to revoke that access through blockchain, they would have full control themselves. So it has been quite a few years of work there. There's a very well-established team that works on the blockchain work in the MedLink platform and publications that come out of that. And now it's heading towards from the initial early stages, which were more, the methods and basic aspects of piloting such a platform and making it work, to now lean into something that eventually can become practical and be utilized in a specific medical use case, like in the utilization of HIV patients in the coordination of PrEP services. So that project is running right now. I think it's on the last stages of actually closing up in the development and the pilot. It's not going to be with real individuals yet. I think that's the next phase of it, is actually going to a real implementation in real settings. And PrEP likely might be the use case to continue to pursue.
Absolutely. Yeah. Thanks for sharing that example. I think it perfectly kind of encapsulates what is health data that, I mean, all health data is private and very sensitive, but in this particular case, very sensitive, and your ability to control that data and that data being an extension of you and you revoking that extension and access to a third party when you want to. What would you say in terms of, maturity, a technology like this, and it doesn't have to be this particular example, but technology like this being used in actual, patient settings. So like, I know, for example, New York State did something with their COVID-19 pass and doing things around that, and that being, using blockchain to verify that you are you and you're vaccinated for COVID and whatnot. In terms of kind of moving past COVID and this example or another example, what's that time frame that you see? Like, is it 1 year, 5 years, 10 years?
Yeah, I think that's a good question in a sense that, as you see in blockchain, things can go pretty, scale pretty quickly. As we have seen in Bitcoin and other blockchain-based technologies, but at others, because it's complex, maybe the FTEs, right? It's another one that kind of got the attention of the media for a while, but kind of dying off a little bit. But who knows if it is not gonna, just spread like wildfire. I would imagine that it would just take a focused use case, like something like, and I don't think PrEP would be that yet. I think that's one that I think we know very well, the sensitivity of the data, and can be useful, but COVID could have been the perfect one, right? Having a platform that allows individuals to manage the access to pieces of information that they would like to. I think it depends still, right? So one example that I've always thought that would be quite helpful for individuals to, for a solution like this to serve was immunization specifically, because it's like state managed registries that nobody gets access to. And I have kids, I don't know the immunization records and I can't even get a hold of it. And it's so complicated to deal with that. And the state wants to hold it, but they don't want to give it to anybody because the state has regulatory limitations to do anything, and health systems the same. But in the end, I'm here as the patient suffering that I don't even know what immunizations I have had. And what you usually do, you take it again because you want to prove to somebody that you took these immunizations, so you just do it again. So I think the maturity is there, the technology is there, and I could see where it could become utilized in a specific healthcare challenge that it can address well and scale quite efficiently. But I think that's where, because it's a hard concept to grasp, it's about adoption, in my opinion, right? So if you think about blockchain, Bitcoin as an example, it started as that technology adoption that only very technical individuals that would understand would go for it, right? And then once others start getting a grasp of it and seeing the potential and benefit that they could get out of it, then a lot of people start jumping on it very quickly because the financial benefit that was there, right? So can you replicate that in healthcare? It's something that folks really want to have and that can deliver some benefit to them, even if it's not financial and quickly. So that's what could tip the point of adoption, in my opinion, is something that marketing-wise becomes powerful. What that is, I'm not sure yet, but I think that's what would get adoption to increase highly. It's not the technology itself. The technology, to me, it's pretty much ready. In funding for blockchain-related is available in many ways, but it's that marketing aspect that to me would be the tipping point to really get adoption to scale very quickly.
Absolutely. You talking about the immunizations gives me PTSD. Anytime I get credentialed at a new hospital or something, they ask for all of that. And like you said, it's a nightmare getting all of that, in a form that they'll accept and whatnot. So that would be a perfect, if someone can create a tool that, uses this technology and allows mass adoption, that would be awesome. I think, when we talk about a lot of the issues that you've mentioned is an issue of data silos, right? We have data with the state or certain health data with your family practitioner's office, and none of that data talks with each other. And in the ER, that's the same issue, right? Someone could have gone to the hospital across the street, and a lot of times I won't have any idea what those tests were. And like you said, a lot of that stuff is repeated. And so I guess my question is, when we are trying to create bridges, at least, not completely deconstruct the silos, but at least create bridges using this technology, when you have conversations with kind of these larger organizations like a health department or a state, what is their receptiveness to those conversations and being able to say, yeah, we'll give this thing a shot and we'll, potentially make healthcare better?
It's not a simple discussion, right? So to convince the health department in Houston about the possibility of using such a technology required personal relationships and innovative mindsets, right? So someone that the health department that had an open mind to understand that this could be transformational. It's not an easy thing. You can't start from the bottom down, to the bottom, from the bottom up, to convince a state organization, a county organization, a healthcare. You'd have to find that individual at the top that would understand enough the data challenges, understand enough the potentials of something like this to then make a case that the rest of the organization would follow. Otherwise, at every step of the process, you're going to find brick walls because folks are just hearing about this stuff that they can't grasp. They don't see the value. They don't know where this is going. They're spending time to kind of go through a project to build something. It's a tough, process to go through. So you have to be very strategic with who you're working with to actually get an implementation done. So there isn't not necessarily an openness to work with the state government. I think Texas is working currently into getting our driver's licenses digitalized in such a way that you could have your driver's license in your phone. Other states have that already going on, and Texas, I think, is working towards that. That will be transformational, but it's not in place yet. And I would imagine to get something like that completed has taken a tremendous amount of partnership and work with the state to get something like that done. And that's not even healthcare data, which to me is a lot more regulated than just your driver's license, that could be replicated in a system like using blockchain. So it's a tough wall to climb. And if you're not placed within the right organization with the right, I think we get to do some of those collaborations with the health department in Houston and our, Medicaid's office here, because it's the University of Texas and researchers within the university. But I can't see when we see startups that are trying to solve some of these data challenges using something as innovative as this, approach health systems and approach the state, it's a tough wall to climb for them to get out. And I think that might be what makes healthcare startups and technology not as effective, because it's very hard to get into the ecosystem. And as you know, it's not so easy to understand the compliance requirements, for healthcare data. And where many healthcare giants also have failed, right, to leverage what happened. So I think you have to be very strategic on the vision and slowly win into one of the partners and slowly grow a footprint to be able to prove that a solution using blockchain would be effective. But it's finding what is that problem. Like in our case, you're working with Brad, that this can make a difference, right? I could say the same for, virtual reality teaching in medical school, right? Where you could basically put a headset on instead of having the dummies for you to look at and do a surgery. You could have VR equipment attached to you, and you can actually perform a surgery, without having anything physical present. But I can see the value, and we have some things going on here in a medical school that are utilizing technologies like that. But it's a tough, technology to crack as well. If you can imagine the precision of something like this, you would need to be at a very high level to compete with current other physical solutions. So, but at the same time, if you see the potential, and that's where investors come in and they say, okay, well, to get one of those, devices that pretend to be a human that students can practice on costs this much. And this is how many there are in the country. But through VR, it can cost us, I don't know, $5 million to develop it. But once it's done, and you can replace all this stuff that's out there all over the country, then you can really see the numbers make sense, right? So anything is possible if you have a business case around it to adopt a solution. But you have to have that problem that's a good fit. And I don't think that's an easy thing to collaborate with the state government in those large data systems, because the regulations there are so hard to deal with.
Yeah, and that makes total sense. It's obviously everything has to be, above the bar when it comes to privacy and the solution itself and ease of use and adoption. But at the end of the day, when you're talking to, a business entity, that being financially viable is a theme that I continuously see that has to be there as well. And so thanks for making that point. The other thing that we kind of alluded to at the beginning of the conversation was social determinants of health. And, there's so many innovative ways to, study those determinants, address solutions. Are there any kind of use cases or examples that you've seen, whether it's at UT or other academic institutions or even private entities, that are creating Web3 blockchain-based approaches to understanding and solving some of the disparities we have in that area?
Well, the technologies and tools that we have been building for the last 5 years or so are pretty advanced in SDOH. I can say that because we work federally with the key organizations developing the standards for SDOH data management and coordination, and we are have pilots with the federal government, with OMC, with the Gravity Project. So we're pretty involved in these at that level, right? And we feel like we have a good pathway there on how to better coordinate social services. But there hasn't been that connection yet. It's from our use case yet. And I'm not saying that there isn't, but between the SDOH goals and the blockchain value. But I can see where in some situations it will become quite powerful very quickly. The example that comes to mind is one of the biggest problems we have here in Austin is homelessness, as you may have heard, and you have in Houston as well, although you have done a great job there in improving that. But a while back, we built a mobile app that we were planning to give to homeless individuals so that we could actually have a relationship with them and track their needs and help them. They wouldn't want anything to do with that app because they were like, oh, you guys are going to have my data and you're going to know that I'm taking this drug and then you're going to put me in jail or you're going to deport me, whatever it was. So blockchain becomes very interesting for homelessness. The challenge is still the same one that I described earlier, where educating individuals that their data now is not in anybody's hand, it's in their hands only. It's not a simple thing to explain, right? But if you can get that understanding moving faster, I can see where homelessness blockchain application would become quite powerful in terms of coordination of services. I'll give you an example. The amount of food that just go wasted every day at restaurants is out of control. At the same time, that there's a lot of people that's going to spend the night hungry. It could be a very simple linkage between restaurants and individuals that I have food here that is free and I am hungry here. And we are in the same block. I can walk right there right now and get it. But I don't want you to know who I am, So you could visually conceptualize an ecosystem like that that could provide real value for specific aspects of SDOH and utilize blockchain. Of course, there are many other use cases there, but I think homelessness has been one that we know for a fact blockchain would become quite helpful. But again, as long as you are able to explain to the homeless individuals that their data is not really going anywhere. The other challenge there is, do they really have mobile devices? Which is another issue that we found is not necessarily widespread yet. And who pay for those devices? If you're having a hard time eating, and finding a place to sleep on a cold night, a cell phone might not be as important. So one of the solutions that we did find for those folks that attracted their use was an app that also stored their credentials and their documents. We found that they very often lose their birth certificate and they don't have documents, and documents are necessary for everything that they need help with. So the city of Austin actually built an application that did exactly that, that would be able to validate documents and store electronically so that the individuals could always have access to that in a mobile device. So there's an intersection there between homelessness and blockchain that I think would make a very viable solution. But as long as you can, go beyond their fears of the control that maybe comes with it. In this case, there wouldn't be a control, but the fears are still there.
Yeah, two potential use cases of homelessness and hunger, two massive issues in the United States, and that would be really interesting to see if there's parties that address those issues through blockchain. And even in the setting of healthcare, one of the biggest issues is trust between insurance companies and the government and providers and whatnot. And potentially blockchain can address some of those trust issues, and so maybe addressing some of the trust issues when it comes to those that are homeless and between them and the government and other organizations through blockchain potentially would be very intriguing, interesting, and I hope to see more work being done in that area. One kind of thing that I saw, and this may be completely non-blockchain Web3 related, but I saw that you kind of work with the Health and Human Services on their Information Technology and Advisory Committee, and if you could just kind of share what your role there is. I'm just kind of curious to learn what you do in that capacity and anything you could share from that.
So you're familiar with the Office of the National Coordinator for Health IT?
Yes. Yeah.
Okay. So they basically define the standards for health information. They also, the organization that federally managed the rollout of electronic health records nationally and made sure that they complied with the standards and they were certified to be used by providers. So NC plays a big role for HHS federally in terms of informing. And now it's expanding a lot to CMS and CDC and other federal agencies, the importance of data standards and interoperability. So I sit on the Health IT Advisory Committee, which basically address pressing charges in terms of data standards and policy federally, and informs the Secretary and Senate, the US Senate, and what could be some of the strategies and some of the needs that federally are important. So that high level, that's what HITAC does through several task forces. So examples, one task force that we did this year was for e-prior authorization. That one provider and a payer are trying to figure out how much a service is going to cost. How do we coordinate that electronically to optimize that process, right? And as I have a view of the patient aspect and participation in their health, my questions were like, how can I inform the patient? Because it's the only service that I go to still today that I have no idea how much it's going to cost, and and just go for it. And a lot of people probably don't even start because the fears of how much they're going to be charged, right? So to me, it's a three-leg step of prior authorization. Is yes, the provider, the payer, but the patient should be there as well to see that picture of what is taken for the procedure, for the whatever it is that's being prescribed to them. It's going to cost. It's going to take. So there's no standards for that today. I mean, it's a very broken piece. That was one key aspect that we addressed in some ways through a task force that then becomes part of a federal report that goes to the secretary, that goes to the Senate. And that's just an example. We have worked on public health reporting recently, patient access to their data. So there are several topics that need attention, and there are quite a few, specialists that are invited to be part of IATAC. They are appointed for 3 years, and then renewed, I believe, for another 3. But that's high level. What that.
Awesome. Yeah. Thanks for sharing that. It's always good to see, people who are smart and knowledgeable being involved with public service and government. So thanks for volunteering your time through that. I guess my final question, and when I started this podcast, I didn't realize a lot of med students and residents would listen to it, but that's kind of what it's morphed into in addition to other folks. Just, say someone's a student at, Dell Medical School and whatnot. Do y'all have med students work kind of in your research labs, in particular in blockchain areas and kind of some of those technologies and apps that you're developing, or is that something that's more kind of still off limits? Or just if you could shed any light towards that.
No, we do. I don't think currently, but like I said, that blockchain work has been going on for several years, and we have had different levels of medical students participating. Like in the early years, I remember very well how they were quite involved on the use cases that we needed to pay attention to in terms of how, like, having medical data in a blockchain and who could control what. Things like, if someone is a young person, what would they want their parents to see or not, as far as their data goes? Could they control granularly what their family could see, or what their doctors could see, or what their community health person could see? So they helped kind of define many use cases that we consider why we designed the blockchain tool. I think there is one right now that approached us that would like to get involved, that I'm collaborating with them. But yeah, that's a common thing that we have, not only in the blockchain, but pretty much every of our informatics projects that we have a medical student. We attract them. We have a health learning apprenticeship program within the medical school that does exactly that. They have a specific process by which medical students can get involved in research projects, and we do leverage that quite a bit.
That's awesome to hear. I'm jealous. I wish when I was in med school, some of those avenues were available, but thanks for, sharing your time and shedding some light on the work that UT does. As a Longhorn, I'm always excited to see, UT and doing amazing things. And this is definitely something that, as I mentioned, my med school never did, or they still, I follow what they do. They don't have, any research or work in Web3 and whatnot. So good to see you guys doing that. Thanks for sharing your time. I really learned a lot, enjoyed our conversation, and thanks a bunch.
You're welcome.
Hope you have a good rest of your day. Happy holidays. And I look forward to running into you at some point in the future. Bye.
Happy holidays.
Bye.